when we talk about healthcare and when we talk about the well-being of a person, we forget that apart from the physical health, there is also mental well-being that we need to take care of. On the 10th of October, this World Mental Health Day, it is important to understand that mental health, though, is a bigger umbrella, but under it there are various facets that we need to take care of: depression, substance abuse, anxiety, and so on and so forth. Sometimes we wonder that if this burden of depression or mental health disorders, if it's rising in the world, and for example, the British Charity Mind says that 1 in every 4 people could be suffering from a mental health disorder in any given year, at any given point in time. So that really makes us wonder, because I mean, if you look around us in our communities, in our workplaces, we'll find that this is quite a disturbing number, and we wonder, how do we come to know if we could be at risk? Now, I'll put forward a question to you. It's the same thing as asking, are you at risk for a cardiac disease? Are you at risk for a kidney disease? The only way to know this is to get some tests done, and you can't really know this at your home or through your behavior. That's really not the right way to assess a problem. And the other thing is, so why should I go to a doctor? Why should I go to a hospital to get myself tested? Again, just like we get ourselves tested as in terms of preventive health every year, every 6 months, after a particular age, I think this test should also be done. This is unheard of. People do not talk about it. People do not know. There aren't any packages on it yet. But perhaps talking about it is one step forward in getting this done. So I would not say that by looking at a person or by observing a behavior of sadness, you could say that the person is suffering from depression. This is really not for us to say. It's a clinical disorder, it's a disease, and it has to be figured out by the correct healthcare provider only. So again, very interestingly, we sometimes relate the onset of a problem to the presence of a problem. Now you must have heard, I'll draw an analogy, you must have heard that when someone has a slip disc, it does not happen because of something that happened immediately. It is an outcome of something which must have gone wrong over several years with bad posture and the likes of it, and it finally results, the outcome is a slip disc. Now this period in mental health is called the prodrome, and sometimes depression may exist within, but it's not symptomatic, it does not get shown in any kind of a behavioral change. So again, it is very, very difficult to say what was the time when depression actually onset, but what we see is the outcome, and then it is the outcome that we have to look at and try to treat the person who's suffering from it. While there is definitively a chemical imbalance in the body, it could also be the deficiency of certain vitamins, zinc, selenium, magnesium, vitamin B12, so minerals and vitamins obviously. It could also be yeast, a lot of yeast, that could cause mental disturbances. So all of these things, once they are understood by the medical practitioners, and if they feel that a person presents symptoms, and when they are tested, then I think these tests should also be done. And only accordingly you can, when you're prescribing medicine, sometimes these prescriptions are also important for the doctors to provide to the patients. Of course, self-medication is always harmful. Everybody is advised to take in optimum doses, a balanced diet, which today, as we see, is mostly absent. And malnutrition is not just taking too much food, it's basically not taking the right food. So we see a lot of outcomes of malnutrition, and mental disorders could be definitely one of them. So, when we talk about the triggers of mental health, they're physiological, psychological, genetic, and environmental. So, when I say environmental, a lot of people are going to wonder where this is coming from. So now we have to understand that these are not causing, they're triggers. So Let's look at environmental factors or climate anxiety like floods, increased temperature, heat waves. We are talking about air pollution, and most importantly, the lack of sunlight. So, if the climate is affecting all of these things in terms of the weather of certain places, then all of these things together or separately also impact the mental health of a person. Lack of sunlight is one of the major causes. Now, how that is affecting the chemical imbalance in the body is again a subject of research, but these are associative factors, and this is what climate anxiety is all about. It's a big topic, a lot of work is going on, but at least we are talking about it, and that is how I look at how we've progressed. We've started talking about all of these things and generating awareness on them. I have a short summarized message to give to everybody, especially on the occasion of World Mental Health Day, and that is that with so many other problems, when you see certain symptoms, you start wondering. For example, if there is a lot of urination, like they say, and if you sweat a lot and if you start losing weight, the first thing that comes to your mind is, could I be diabetic? And then you go and get yourself tested. Similarly, if your heart rate suddenly increases and if you have difficulty in doing the things that you otherwise were able to do, you wonder, could my heart be at risk? Similarly, with certain other things, you wonder if your kidney is at risk. With all traditionally, with all the things that we believe could be indicative of a mental health disorder, the most important thing is go and visit a doctor. Do not try to curb it by saying that let's provide a sympathetic support to the person who's exhibiting these symptoms in the hope of thinking that mental health is a stigma and we do not want this stigma to be a part of our family, and let's provide the sympathetic support. The worst, never say everything is going right for you, so what are you mentally disturbed about? That is not empathy, because we are not in their shoes. We do not understand what could be going wrong within their bodies. So the only step, the only support that we need to take is to take this as normally as we do take other diseases. We are not happy about them, but we do not stigmatize them. We try to look for their treatment and cure, and we visit the right expert, and we do not try to do any home remedy. Talk to your doctor or even your family doctor. I think that's the best step. Talk to him and he will know how to take this forward. Thank you.